Hello, and thank you for joining us for the Kidney Times, timely talks with a kidney transplant recipient. Today, our special guests are Toni Benz and Robert Crabtree, who are going to share their thoughts, what to expect after transplant surgery, and how to sustain the new kidney. My name is Precious McCowan, and I am a transplant recipient and a patient subject matter expert with the End-Stage Renal Disease National Coordinating Center. The ESRD National Coordinating Center partners with patients, healthcare providers, and the Centers for Medicare and Medicaid Services, also known as CMS, to create and share resources that help kidney patients improve their quality of life. According to statistics from the United Network of Organ Sharing, kidney transplant is the most common organ transplant surgery performed. In this surgery, kidneys that are not working are replaced by a kidney from an organ donor, living or deceased. If the transplant is successful and the kidney continues to work, the recipient no longer requires any kind of dialysis. There are more than 97,000 Americans on the kidney transplant waitlist. Our guests today are Toni Benz and Robert Crabtree. Toni Benz is a kidney transplant recipient from Riverside, California. Her end-stage renal disease journey began in 2008. She received a deceased donor kidney in June of 2019. Toni is an active member of the ESRD Network 18 Patient Advisory Committee and the ESRD National Coordinating Center National Patient and Family Learning and Action Network. She helps develop resources to assist patients and families becoming active members of their health care. Toni says she gets her strength to thrive with kidney disease from her faith in God, taking an active role in her health care, and support from family and friends. Toni is looking forward to returning to clinical practice as a licensed marriage and family therapist in California. And Bob Crabtree is an end-stage renal disease survivor from Linwood, Washington. His dialysis journey began in 2008, and he received a kidney transplant in June 2010. He said he feels his success as a transplant recipient is due to mentorship from family and fellow patients. Because of this, he decided to pay it forth by sharing his story with other people, and that led to the formation of the Road Back to Life, a nonprofit organization that provides mentorship all over the nation. He's served as the organization's executive director for the last 7 years. He is also in his 6th year as member of the board of directors of the local dialysis providers foundation and a patient advisor for the Northwest Renal Network. Bob is a retired Subaru technician. So with that being said and those introductions, Toni and Bob, welcome to the podcast.
Thank you very much.
Thank you, Precious.
Absolutely. So the first question is for the both of you. Could you explain how did you first hear about kidney transplant and treatment options for kidney disease? And Toni, I would like to start with you.
Thank you. I researched. As soon as I found out I had kidney failure, the question was, now what do I do? And how can I get a transplant? What's necessary? My doctors and nurses informed me, and I made decisions based on that. So it was just right away.
Okay, right away. So Bob, what about you?
Well, my story is a little more complicated because I had a lifetime with kidney disease. I have a genetic disease, and so I've seen my father and my aunts, my uncles go through this. And so, I was really lucky being of the right age to where dialysis became a treatment that we could have, and then transplant as well. So, to be honest with you, my earliest recollection of realizing that I wanted to get a transplant was when I got married. And that was in 1979. So that became, at that point, it was okay, I got to do something. I want to be around long enough. So I think that's basically when I did it.
Okay. So, Toni, I know that your transplant journey began in 2008. However, you received a kidney transplant in 2019. So I would like to ask, how and when did you decide that it was something you wanted to pursue?
Again, immediately. Once I was diagnosed, I researched treatment options and modalities. For 11 years, I was on peritoneal dialysis, being able to do that at home. And throughout that process, I knew there had to be another option, which of course, transplantation is a treatment, not a cure. So I did that. I sought it out, talked to my doctors, found out what I needed to do, and decided on which hospitals, because I was listed at 2 hospitals, to make sure I was able to obtain that transplant as soon as possible. And
Okay.
I, because I had I decided to wait for a deceased donor. My journey was a little bit longer, and where I live in California, the need is so great, the wait time is longer. I think Bob said you're in Washington, and therefore transplants in different parts of the country come a little quicker.
Mhm.
Yeah, by
Absolutely.
yeah.
Go ahead, Bob.
Yeah, and answer your question, I think I did already, but I can kind of, elucidate a little bit on it. But I decided, like I said, when I was married, that's when I decided that I was going to pursue that, and also had a lot more information about it because my family was doing it, and in the end, all of my aunts and uncles did end up getting a transplant. Um, from the very early on stuff all the way up to my dad, which, by the way, my dad is 83 this year, and this transplant is doing fantastic, you guys. So, but yeah, so that was it. I think it was getting married and deciding to have a family made me decide to pursue transplant, and that's been my goal since that time. And like
Okay.
you said, the wait list was, I only waited 3.5 years on the list up here in Washington, but that was 12 years ago now.
Mm-hmm.
Yeah, absolutely. So, we all know that there are pros and cons when it comes to being listed for a transplant and even once you receive the transplant. So, Toni, I want to ask you, what fears did you have about the transplant process? Was there fear about the surgery, um, death, asking someone to be a donor, expenses, etc.? What fears did you have?
Actually, Precious, I didn't have any fears. Once I did the research and found out what was going on, I have faith. And when you research and find out what's going on, I went through the process to get understanding. After understanding, I applied wisdom, which was the best way for me. How is it going to affect? And as far as there's always concern, but not a fear. not a fear. I'm not a fearful person. You can't do this walk really and be fearful if you plan on making it through. Bob, you know that, right? And so, and you too, Precious, for that matter. You have to have some wherewithal within yourself to say, I'm on this journey and I'm going all the way. And that's what happened for me. So when I made the decision for transplantation, when I made the decision to even do PD, that's what it was for. It was to take it all the way and do everything I could possibly do to keep myself healthy enough to make it through to transplant.
I love your response. I really do. So thank you for that. What about you, Bob?
Well, I agree that the fear wasn't there. The fear wasn't there because I had had mentors all along, you know, my family, my dad. And so for me, it was just the next step in the progression of dialysis. I like to tell people that I really wasn't afraid of starting dialysis until I did. And then, even then I had all this experience. I was with my dad when he had his first treatment, but it was different when it was me. But, 1 hour in the treatment and I was, just talking my head off with the patient next to me, and it just became something I did. But there was some trepidation. I was definitely not really comfortable asking people to donate a kidney to me. That was really tougher than I thought it was going to be. I did, and I had 3 people to step up and tried to donate me a kidney. The process, the death, no, it never entered my mind. I was so excited about the possibility of leading a normal life that for me, transplant was like the Holy Grail. It was what I wanted. I would do whatever it took. And it's worked out so far for me.
I love you guys' energy and just your positivity around receiving a kidney transplant. So also, we know that as transplant recipients, there is some period where we are kind of resting, we're down, maybe a couple of days after we receive the transplant. So Toni, I want to ask you, what were the biggest challenges in recovering from the surgery? And also, how did you overcome those challenges, even if you had any?
I want to go back just a second to the previous question in terms of asking people. I'm married. I have no children. I have nieces, nephews, godchildren, and a whole list of family. But I decided, because of where I was in my age, I was okay with waiting, if necessary, for a transplant. My nieces and nephews were all they were beginning their lives, families, and that sort of thing. And I really didn't want to ask them. I did have 2 friends who made the journey towards transplant, toward donors, but one we found out could not because of a medical reason, and the other, we were scheduled. We were a week out from transplant, and her last test came back and that she couldn't do it, and her medical situation was in question. And actually, I was really grateful that we found that out about her, because she could focus on the things she needed. But as far as post-transplant, it was really okay. I had no complications. I had a deceased donor kidney, and I was at hour 19 when it was placed. I was rushed in like, I know you're not asking a question about whether or not this kidney is right for you. Get in there. The gurney was just slid into the operating room, and my surgeon was like, I know she didn't just ask me that. Yeah, well, I did. But, afterward, it took probably a day and a half, 2 days for my kidney to wake up, because it had been on ice for so long, and there's only 24 hours before you can window for you to be able to transplant. So once it kicked in and started saying, hey, how you doing? Talking to all the other organs, talking about we're going to be around for a long time. Let's get next to each other. Let's be happy. It actually went pretty well. But of course, whew, those that first 3 months was something in terms of just getting to treatment, waiting in line to get your labs done, to get to the treatment center. Oh, that was the process. But other than that, going through the process, I was grateful. I was grateful.
That's awesome. And Bob, what were some of your biggest challenges in recovering from the surgery? I know that was a while ago for you.
But it was an amazing time. And I want to go back to the question before too, because I can't remember your name. I have a terrible problem with that. But you brought up a really good point. I want to say that my wife was not compatible. The one guy that was going to be compatible decided not to and disappeared and left the state. And then the third person was a really good friend of mine, and we found out he had kidney cancer whenever we started the testing. And so him and I spent the last of his life as kidney patients together. And he wouldn't have known if it hadn't have been for trying to donate to me. And because of that, he was actually able to get all of his affairs in order. And we spent some quality time together, and he and his family. So that was good for me. Challenges. My transplant story, I think it's amazing. And people tell me even today, and they still say it is, but I got the call Friday at work and at noon. And, I went up to change clothes. And when I came down, I was a mechanic, right? I had to get out of my uniform and wash the grease off. And when I got back down and I come out, the entire staff of the dialysis or of the dealership was there. And they all, gave me the heroes thing and a pat on the back. And somebody went and got my car for me, so I didn't have to walk very far. I could get down there. And Friday night, I'm sorry, about 11 o'clock, the doctor comes in and he says, "Been a long day, Bob. I just finished a pancreas kidney transplant. Do you mind if I take a nap?" And I said, "Yes, please."
Please.
Please. And so 6 o'clock in the morning on Saturday, they rolled me in. I saw my new kidney. I got to see them while they were cleaning it up and preparing it. I was out of surgery by 11. I got out of my bed and I took my first walk at 1 o'clock. And Monday morning at 11, I was having breakfast with my wife at home. I spent about 50 hours in the hospital. I know, it's amazing, And
it is.
And there's a trick. If you want to get out of the hospital, then when they tell you need to get up and walk, do it. But really pay attention to whenever the transplant team does their rotations. So I knew what time they were going to be in the hallway. So I always went out and I was in the hallways when they showed up. I got out of there. So for me, I had so much energy after transplant. It was incredible. And I think this one is kind of silly, but it really kind of stands out what a difference it is between dialysis and transplant. At 11 o'clock at night on Saturday night, when I'm in the hospital, they bring me a pitcher of ice water in a glass with a straw in it, right? I nursed that glass of water until the nurse came in and asked me what I was doing at 3 a.m. She said, "You should be done with that first pitcher." And I've been so long without being able to drink fluids, right? So that was one of the really big challenges, was relearning and rethinking how I lived. It was, and then that first dinner afterwards, when they allowed me to have spaghetti, it was like, all right, yeah, what, really? But yeah, my kidney was making urine as they were putting it in. I did not. Saturday morning, the dialysis team came in and said, "Your creatinine's at 2. It's been a pleasure giving you dialysis, and we're not going to see it, again." And so exciting, ecstatic. And then, we should talk about the prednisone coming down off of sometime. That is just an amazing story after transplant. So I guess that's most of my story.
Well, thank you for sharing that, Bob. Toni, I want to ask you, you've had your transplant going on almost 3 years. So what are some of the things you are doing to maintain the health of your new kidney.
Taking that medication on time every day, my clock, my watch, my phone, everything is set. My life is around my medication, because 11 years, baby, I'm not giving that up anytime soon. No plants, no pets, and no germites. You know what germites are? Germites are the little babies. I love them, but you know, they germites. They're they're carriers. And so and with the pandemic, right, I was going to take my mask off at about 6 months. Well, that's right when the pandemic hit. So I've been in mask since, planned on being in it a while longer when I'm out and around people. Without an immune system, I'm not taking a chance. And so that's the main way that I've been taking care of it. You know, my medication, my meals. I do struggle now with trying to get the right meals, because like you said, Bob, this idea that, oh, you can eat anything you want, I don't believe it. I do not believe it. And between the three of us and anybody else listening, I wasn't very happy with my post-transplant dietitian, who said, oh yeah, try box foods. And I'm like, what? I have not had a processed meal in, 11 years. So so at this point, I am still working on an effective menu to keep my kidney healthy and still be able to enjoy a little more freedom in my menu. As Bob said, that whole water issue, fluid, and we know fluid isn't just water, it's anything liquid at room temperature. Okay, so I've had to retrain my brain to take in more fluid after 11 years of, no, I'm not having that. Jello, what is it? So in this time, I'm walking to help that. I gained 50 pounds. Can we talk prednisone? That's what you want to talk about, huh, Bob? Yeah.
Craziness, the weight gain. Yeah. God,
okay.
The eating and thinking about what you're going to eat next while you're eating.
Because of freedom, right? And my taste buds came back.
Yep.
And so, yeah, that post-transplant, I did fine for the first, I'd probably say 5 months. And then it was Thanksgiving. Whose idea was that? I had some See's candy, which I hadn't had in all of the time. I had to stop myself. I just had to say, Toni, enough. And I'm not a big chocolate lover, but right then, I think I went through most of the nuts and chews that they had in the box. So relearning a good menu post-transplant to keep this kidney healthy, because to say do what you did before, oh, you can eat anything, that's ridiculous. Because if I don't know how I crashed into kidney failure, then I'm not about to crash into it again to in any way injure this new kidney. It is a blessing. I am grateful. And it is not an easy thing to understand that I'm living because someone else passed away and their family was willing to share that extension of life for me.
Yes.
I call my kidney Cleo. It is my kidney life extending organ. And Cleo is going to be well cared for. I want them to transplant Cleo when I pass from something else, just age or something, okay?
Yeah. Thank you so much for sharing that, Toni. I'm trying not to shed a tear myself because I know what you're feeling with receiving a deceased kidney and just the gratefulness that you have for
Grateful.
that family.
That's
Yes.
right.
And so very quickly, with 1 minute or less,
Okay.
Bob, I want to start with you. 1 minute or less, what advice would you give to someone thinking about getting a transplant?
Do it.
Ditto.
Just do it. And you know, you can't get it if you don't start the process. I mean, talk to your doctor now.
Immediately.
Immediately. You're wasting time if you don't.
Right.
Okay.
And with a kidney transplant, it is time on, not necessity, as with a heart transplant or other organs. It is time on the list, and it depends on where you are in the country, and even a county sometimes. So as soon as you can, do it.
And dialysis time
Absolutely.
counts.
Do that dialysis. If you don't do your dialysis, you don't get the kidney.
That's right.
You have to remain on the list, and there's things that you must do to do that. So if you're not serious, don't do it, because it's a process.
Absolutely. I agree with what you guys have said. So Toni and Bob, it was a pleasure. It has been a pleasure speaking with the both of you today. Thank you so much for being very candid and open about your journey. Thank you for sharing your experiences. Many patients find it helpful and reassuring to hear from those who have firsthand knowledge about transplant experiences. We are grateful you took the time to share your story with us today. Thank you so much.
Thank you for asking.
Thank you so much.
God bless you both, and go kidney.
Yeah.
Oh, kidney.
12 years now. Yes.
Yes, I'm looking for however many I have, and like I said earlier, this kidney is going to be transplanted to somebody else. I'm going to take that good care.
Sounds good.
Absolutely.
Take care, everybody.
So, take care. We thank you for listening to this podcast. To listen to the rest of our podcast series on transplant, for additional information on the kidney transplant process, visit the End-Stage Renal Disease National Coordinating Center website at www.esrdncc.org, or talk to our healthcare provider, or talk to your healthcare provider.